So one other thing I understand the Kids Center can provide treatments for is chronic sleep disorders. How do you approach treatments for something of that diagnosis?
You wouldn't believe how common sleep disorders are. We know that sleep issues are generally traced back to our circadian rhythm cycles. So we actually have a system in the brain for on and off and light and dark. And the circadian rhythm cycle comes from an area in the brain called the suprachiasmatic nucleus, which is triggered by light. We live in a severely blue lit environment. So we live inside most of the time. So we're under artificial lights, getting overexposure to blue light. And we miss out on ultraviolet, infrared, and all the other colors of the spectrum. So one of the main things that we do is look at a patient's environment. And we come up with a way to look at how their system is working, and then not only change their functional medicine imbalances and their nutritional status, but we have to look at things like DHA and their light environment. And then when we change those things, we're able to see significant changes in their sleep habits. You know, you can't just take melatonin or sleeping pills and expect it to go away. You're just treating the symptom. What we do is always strive to look at the cause. So, extensive light exposure, like full spectrum light, is very important. Sufficient water intake, and even magnetism, believe it or not, is something that is powerful driver of the brain. So when we look at all these things and how they affect our mitochondria, which are the powerhouses of the cells and our energy production aspects of the cells, we're able to really undo some of the damage that people have done and then help them get back on normal sleep cycles.